Today's Activism segment comes to you, as always, in partnership with the UnFuck It Up project, where creator Katie Goodman and activist director Katie Klabusik highlight individuals and organizations working to change the world. Today's campaign, Repealing Hyde. Affluent women in this country have always had access to the full slate of reproductive care, including abortion. As reproductive justice reporter Andrea Grimes writes at RH Reality Check, abortion is not the alternative to parenting. It is the alternative to pregnancy. It is a medical condition that should be attended to by a patient and their physician. Those with means have always viewed it as such and treated pregnancy and the decision of whether or not to carry to term with the privacy our nation's Constitution dictates and the Roe v. Wade decision affirmed. 37 years ago last month, however, Congress passed the Hyde Amendment, taking the right to choose away from those who happen to be struggling financially at the time they seek care. Financial insecurity is already a factor in creating conditions that lead to unintended pregnancy. The simple lack of doctors and clinics located in disadvantaged areas compounds the problems of those with chaotic lives due to low-income work schedules and inadequate education surrounding preventative care who are the most likely to need abortion services. Denying access to those relying on Medicaid for their health insurance has strained resources at the local, state, and federal level while further weighing down communities already burdened economically. The Center for American Progress released a study on which groups are affected most by Hyde. The results will likely surprise no one listening to this show. From their report, quote, "The Hyde Amendment intentionally discriminates against poor women who are disproportionately women of color. In this way, the Hyde Amendment is a policy that not only violates reproductive rights and principles of gender equity, but one that undermines racial and economic justice as well," unquote. In 1980, Supreme Court Justice Thurgood Marshall predicted as much in his dissent to the decision that upheld the discriminatory law. The Hyde Amendment was, quote, "designed to deprive poor and minority women of the constitutional right to choose abortion. For women eligible for Medicaid, poor women, denial of a Medicaid-funded abortion is equivalent to denial of a legal abortion altogether. By definition, these women do not have the money to pay for an abortion themselves," unquote. It's long past time to remedy this injustice and restore the right to full reproductive health care access to disadvantaged groups. A number of reproductive justice organizations are spearheading this effort through education, petition drives, and public political pressure. All above all, the National Network of Abortion Funds, NARAL, Pro-Choice America, and others have petitions and forms to contact your legislators, something you can do on your own, as always, at contactingthecongress.org. As the movement to repeal Hyde grows, the National Network of Abortion Funds are aiding those left without access to care. Texas is in particular need. The Lilith Fund and its amazing volunteers are working overtime to aid the spike in those affected by new statewide restrictions on doctors and clinics. You can help their efforts by donating or just spreading the word. If you want to get involved closer to home, you can find your local abortion fund by visiting fundabortionnow.org. Volunteers and donors are always needed. Links for today's campaign will be in the show notes and all the usual places, and please visit the Best of the Left Facebook page for updates on this and other activism opportunities.